Hi, I'm Nic Brown from Integrative Physiotherapy and welcome to our YouTube channel. I'm here to talk about the importance of rest when you live with persistent pain and some of the misconceptions around it. So firstly, by persistent pain, I mean pain that's been around for some time, ranging from a few months to many years. And it usually has a significant impact on someone's life, such as their ability to work, socialise, to be active and do the things that they enjoy. So it's really important to manage it effectively. People are always talking about the importance of being active and exercising, especially physios, which of course are also key for our health. But we can't be active necessarily all day long, and we could be likely to flare up our pain if we did. So we can see rest as firstly preparing us for an activity, such as planning a sit down before going out for a walk, or pausing in the car before getting out to start work. It can then aid in the recovery process after any physical or mental exertion. So a lot of people I see with pain also struggle with fatigue. So rest can be as important after something mentally taxing, not always physical. So rather than going from checking emails to booking something important or having a meeting, you would perhaps try and put some kind of pause in the middle of that. Or again, come back to the physical side of things. If you have been out shopping, rather than coming home and launching straight into unpacking or preparing the meal, trying to plan a rest in between these things. So I hear a lot of guilt around taking a break or resting. A lot of people I see struggle with this. They see resting as lazy, as that they're giving in to their pain, the pain's beating them in some way. So changing how you see rest, I think, is really important. So if you catch yourself saying things like, I've started so I'll finish, this can be a sign that you may push yourselves potentially too much at times, but only you can be the judge of that. So seeing rest as another technique to help you to manage your pain and or fatigue can help. It's part of your recovery plan. So framing it in a more positive light and also bringing some self-compassion to this. So when you feel that you may benefit from some rest, or think what you might say to a friend, which is often a lot kinder than we would say to ourselves. Obviously, resting too much can also be a problem, and this isn't about sitting down all day, but done in a timely way, I believe, balanced out with other activities, rest can make your pain and fatigue easier. So rest is part of pacing and planning out your day, where rather than waiting for your pain to be worse before stopping, you can anticipate an increase in pain if you were to keep going, and you can choose to sit down sooner to avoid a flare-up. Or obviously you can also choose to keep going, and that's another conversation for another day. There are no formulas to use to get this balance right, and it can involve a lot of trial and error. So think about how you could perhaps plan in more rest into your day, earlier than perhaps you think you need them, especially if you're someone that tends to push on and won't sit down until the job is done, or maybe wait right until the end of the day when maybe it's a bit late. So think about setting yourself some realistic goals for what you want to achieve each day, not what you think you should be doing, what others think you should be doing, or perhaps what you used to do. This is likely to have changed since pain came along. So you're listening to your body perhaps a little bit more, rather than waiting until you feel dizzy or your legs start giving way before you give yourself permission to stop. And then you can decide whether you want to stop and break or whether you want to push on. So rest doesn't have to be just sitting or lying down and doing nothing, although it can be. It may be listening to some music, some easy reading, enjoying a hot drink, or looking out the window watching the birds. It can be doing some breathing exercises or some formal relaxation like a body scan or visualization, or some gentle stretches. So have a think what would work for you, and that may be different every day as well. So thank you for listening today, and do share your thoughts and experiences below. Subscribe to the page to keep up to date with the latest releases, or share this video with someone that you think needs to hear this today. Bye for now.